One of the things that people with post-traumatic stress disorder or PTSD are concerned about is stigma. And whether you're a civilian, there's concerns about stigma. In the military, there's an added level of potential stigma that's there because when you go in to be seen, there's a healthcare record that gets established. It's all kind of within the system that's there. So that's been a big challenge at getting individuals who are active duty, at least, to come in to seek out care because there's concerns about that. But the reality is, if you're going to get really good care, you need to come in for care. So being willing to come in, that's part of overcoming the stigma, is understanding that your confidentiality will be protected, but your spouse, your significant other, close people to you might find out about it. And it actually takes a lot of courage to come in for care. And so that's the first piece, is if you're going to get good care, you need to be willing to try to go beyond the stigma piece that's there and come in for really good care. The other piece is, it's not as if stigma is necessarily totally a figment of a person's imagination. There can be limitations that are placed on military personnel if they come in for care. If someone is weapons bearing in their security forces, for example, it might be that temporarily the weapons bearing is taken away. So those are things that kind of add to the stigma. The military, and the Air Force in particular, has done some really important administrative things over time to limit any kind of stigma that might be placed on someone. Security clearance, for example, you don't necessarily lose your security clearance if you're going to come in for care. So there's things that you can do to kind of overcome the stigma piece that's there.